Good morning, everyone. My name is John Rickert, the Education and Communication Specialist with the Rural Health Transformation Center. Thank you to those who participated in our test poll. I'm excited to see that members of your communities are interested in having healthy choices available on restaurant menus. We will have other polls pop up throughout the webinar and appreciate your participation. Additionally, feel free to enter questions into the Q&A pod accessible via the control bar on your screen. We will be leaving some time at the end to answer questions. This is the 5th webinar in our series From Sticking Point to Tipping Point, Overcoming Rural Community Health Improvement Challenges. The previous 4 webinars are available for viewing on our website, as will be the recording of this webinar. A link to our website has just been posted in the chat. You will also be receiving the link to this recording tomorrow afternoon via email. Now, on to the main event. Improving restaurant food environments to support healthful food choices. Today we're going to discuss how to effectively partner with community restaurants to improve healthful food availability, as well as provide an overview of how to measure and monitor change based on our 10-year experience building the award-winning Hearts Beat Back, Heart of New Ulm Project. Here to share some expertise on the matter is Rebecca Lindberg, the Director of the Rural Health Transformation Center. Rebecca, the floor is yours.
Thank you, John. I appreciate the opportunity to speak specifically about our food environment work with the restaurants, and we appreciate you all joining us today. Restaurants can be great partners in your community health initiatives. Over the next 25 minutes, we'll discuss how to work with restaurants successfully. I'll share realistic and sustainable ways to help improve the restaurant food environment, as well as discuss the value of measuring, monitoring, and communicating change for long-term success and sustainability. Before we get too far into the conversation, we'd like to start with a poll question. How are you currently working with restaurants to make healthful eating easier for customers? Check all that apply. Increasing the number of healthy food items available? Are you working towards increasing the promotion of healthful foods, increasing the identification of healthful foods on menus or at point of purchase, making healthful foods more affordable? Or are you not currently working with restaurants at this time? It looks like a variety of healthy practices are being used by the attendees of the call today. So thank you for answering, and we'll continue on in the webinar. The food environment examples I will share come from lessons learned from the Hearts Beat Back, Heart of New Ulm Project, a 10-year research demonstration project in New Ulm, Minnesota. The project was designed to reduce heart attacks in the 56073 zip code in adults aged 40 to 79 years old by improving and controlling modifiable risk factors for heart disease. New Ulm is a small rural community of about 13,500 people located about 90 miles southwest of the Minneapolis-St. Paul communities. The project began in 2009, and the research portion of the project actually ended in 2018. But we're happy to report that the project did not end with the research finishing up. The project was integrated into the community and is now being sustained in the community. Ensuring our initiatives are sustainable in the community is a key priority for our work. It's not enough as a research organization to intervene and show success. We want to ensure that we have lasting impact. I'm not going to walk through our sustainability framework in detail in this webinar, but I wanted to highlight key aspects of the model we deployed to ensure our food environment strategies were successful and sustainable. These included understanding evidence-informed best practices, understanding our community needs, producing an integrated community-supported strategy and action plan, layering in a communication strategy, implementing our interventions, and then measuring progress and monitoring impact. When we started working with New Ulm, we did a community diagnosis. Our initial diagnosis was determined by conducting community health screenings throughout the community. And we found that 76% of residents were either overweight or obese, which exceeded national averages. 38% had metabolic syndrome. 17% reported eating the recommended fruits and vegetables a day. 64% meant the minimum recommendations for physical activity. And there was also a significant underutilization of preventive medication therapies among those at risk. These findings formed the basis for our decisions about the types of interventions that we would use in the research project. And it also reinforced the need to focus on improving the food environment. Understanding community needs helps inform your intervention strategy. So it was great to see that a lot of you felt that your communities were somewhat interested in healthier foods and restaurants. As we thought about our intervention strategy throughout the lens of the social ecological model, we thought about it from an individual, organizational, community, and policy perspective. This is a prevention framework which highlights how behavior, including a person's food choice, is influenced by a dynamic interrelationship among various personal and environmental factors. We use this framework and layered interventions across the community. Working with organizations such as restaurants was a key strategy to positively impact the local food environment. We also knew that it wasn't enough to only make changes at the organizational level. We needed to also influence individual choices to drive people into the restaurants. Therefore, we also layered social marketing campaigns throughout the community to influence behavior change. Once you've identified your intervention strategy, it's important that you understand your target audience. Before we actively intervened to improve the restaurant food environment or attempted to approach restaurants to make changes, we needed to understand the restaurant unique needs, their business goals, and their perceived barriers to working with us. Initially, we held a focus group so that we could better understand the restaurants, their interest in partnering to make healthier choices more available, identifiable, and affordable, as well as to listen to their concerns. We learned that restaurants were interested in being a partner in the overall Heart of New Ulm project. However, they loudly expressed concerns with being asked to do anything or make any changes to their menus or with the foods that they serve that potentially wouldn't sell. The restaurant business has a tight margin and there is no room for waste. When working with restaurants, it's important to remember that this is their livelihood. And although they may or may not value health as a key priority, they do value an initiative that is going to support and not jeopardize their business goals. Keep this in mind when suggesting changes. We also focused on incremental change instead of a complete menu overhaul. We learned that this was going to be more productive with the restaurants. Remember that their perspective may be different than the perspective of those on your team. And this is why it's extremely invaluable and important to really seek their input and understand your target audience. In the end, the restaurant owners and managers were very honest in our conversation. We learned that many were skeptics about the reality of the residents actually choosing healthier food options. From these discussions, we designed our program around their needs, their barriers, and their business goals. This program wouldn't work if we didn't take the restaurant opinions into consideration. This is where many programs fail. Organizations are thinking about their own goals to improve the food environment and impact overall community health, but they're not considering the goals of their restaurant partners in that process. During our time working with restaurants, we also frequently did informational interviews to better understand their ongoing needs, what about the program was working for their business, and what were barriers that they were encountering with the program. If it's possible, it's also important to understand your residents' needs. We conducted resident surveys with adults 40 to 79 years old throughout our 10-year research project. We added questions to help us understand resident interest and value in healthier menu items on restaurant menus. If they weren't interested, it would be harder to influence them to choose healthier menu items. Through this process, we found that 94% of our restaurants or our residents wanted restaurants to provide healthful choices on their menu. So it's interesting to compare what we found in New Ulm to what you all are thinking regarding the interest of your community residents. We also learned that adults were eating out 2 times a week, and only 1 in 5 were eating the minimum recommendations of fruits and vegetables. Also, 25% of residents indicated that it was challenging to identify healthful items on restaurant menus. As a part of the research project, we also wanted to understand the restaurant food environment landscape in New Ulm. This helped us to understand current state and where we could impact change. Our initial assessment indicated that only 59% of restaurants offered at least one non-fried vegetable of any kind. Only 41% offered fruit that didn't have added sugar. Only 29% of the restaurants offered reduced sized portions, and only 26 of the restaurants offered whole grain bread. There are multiple food environment assessment tools you can use to get this type of data in your community. We chose the University of Pennsylvania's Validated Nutrition Examination Measures Survey, or NEMS for short, and this is the one that they use in the restaurants. The NEMS tools are observational measures to assess the community and consumer nutrition environments in restaurants. The measures focus on availability and identification of healthier choices, prices, and food quality. You can find all the NEMS tools on their website at nems-upenn.org. We modified the tool slightly to better meet our needs, and they were flexible in us doing that. And these modifications included a few basic questions that we ask restaurant staff and a few updates to align our questions with the most recent cardiovascular nutrition recommendations at the time. Using all our assessment results, we built our program. And before we dive into the program details, we'd like to ask another poll question. What are your current barriers to working effectively with restaurants? Please choose all that apply. Restaurants aren't receptive. Restaurants can't effectively implement our guidelines and/or our program. Restaurant owners or managers are committed, but the staff can't execute your program or your guidelines effectively to maintain quality assurance. Restaurants can't afford to participate in your program. Consumers are just not choosing the healthful choices, and therefore the restaurants can't continue to offer the selections. Your team doesn't have adequate human resources to manage the restaurant initiative effectively, or your team doesn't have adequate financial resources to manage the restaurant initiative effectively. Great. It looks like we have lots of different barriers that are standing in the way to working with restaurants, but looks like what comes out on top, restaurants aren't receptive. Restaurants can't effectively implement the guidelines that you have right now. Restaurants cannot afford to participate, or your team doesn't have adequate human resources. Great. Restaurants could participate in our Heart of New Ulm restaurant program at one of three levels: bronze, silver, or gold. The achievement levels were defined based on the number of healthy practices that the restaurant offered. 78% of the restaurants that were assessed did not achieve a level at all. All restaurants were sent a report summarizing their results and their achievement levels, and they were also invited to participate in our program, whether they met an achievement level or not. The goal was to improve the food environment, so we asked restaurants to increase the number of healthy practices to at least the bronze level to participate, or if they were already at a bronze level, to move up to either the silver or the gold participation level. Healthy practices were set to be realistic, doable, and sustainable. You'll notice that the healthy practices were not solely about overhauling an entire menu or making significant changes that require a menu redo. These things can be costly to restaurants, difficult to undertake, and hard to maintain. And as you think about some of the barriers you identified, you might want to think about um, the guidelines and qualifications that you have for restaurants to participate in your initiatives, and possibly they're just too difficult for them to undertake. There was an option in our program at the gold level for restaurants to work more closely with our team to create customized, healthier options for their menu. They could work with our staff to do nutritional analysis on this and to define ways to promote those healthier options on their menu to customers at the point of choice. Initially, 9 restaurants joined our program the first year, and that grew to half the restaurants in New Ulm as partners by 2015. So we had a significant portion of the restaurant community that partnered in some capacity with our project. It's important to also consider the value to the restaurant for participating in your restaurant initiative. Will you offer support or incentives? In our case, we offered point of choice signage, which included menu inserts, table tents or flyers. We had door decals that recognized program participation level, quarterly promotions in our communications, as well as communications that we facilitated. And these things included e-newsletters, radio, cable access TV, newspaper ads or articles, billboards, social media. We also offered the restaurants in-service training for staff so that we could help facilitate the program at their site, as well as free consultation with a registered dietitian who led this initiative. Among New Ulm restaurants, those that participated in our restaurant program were more likely to be independent restaurants, so not a national chain, achieve a level at baseline, and offer several of the healthy practices. We did find that it was easier to work with and have more influence to impact change with our local non-chain restaurants. They didn't have the support of the national chains, and they had more flexibility to independently make changes at their restaurant. Among restaurants that didn't join the program, we did see themes. Pizza places, as well as Mexican and Chinese restaurants, had more difficulty meeting our healthy practices. Also, restaurants that served buffet style opted out of the program. It was a priority for our team to not only offer the restaurant program, but also to drive residents to the restaurants to make healthier choices. We promoted the program and participating restaurants, as I mentioned, quarterly. We also conducted social marketing campaigns. An example of that was a 7-month social marketing campaign called Swap It to Drop It, which encouraged saving 100 calories a day to manage weight. This campaign was promoted through multiple channels across the community and included restaurant-specific messaging at the restaurants. We promoted different Swap It tips in restaurants on our point of choice materials. These tips were aligned with the type of restaurants. For example, the fast food tips shown here wouldn't work in all restaurants, so we customized the promotions to ensure the tips aligned with the restaurant offering. These tips changed monthly for 7 months throughout our campaign. Our restaurant programs like the campaign so much, several of them ask us to create their own Swap It tips for specific sites. This flyer was an example of something that was handed out in the drive-thrus at McDonald's in New Ulm. To have a successful, sustainable intervention, it's crucial that you continue to monitor your restaurants to ensure they're meeting program expectations through quality assurance measures. This will help you maintain trust with your residents. You don't want to be advertising healthful choices if the restaurants aren't offering them consistently. Also, continue to monitor how the program is working for your restaurants. We did this through ongoing informational interviews and check-ins. As a result, we did modify the program as we learned more. Another aspect of the program to continue to monitor is how it may or may not be impacting your residents. Through follow-up surveys, we asked residents, how important is it to have each of our healthy practices available on restaurant menus? 78% or more of the restaurants said that the items listed here, fruit without added sugar, whole grains, non-fried vegetables, healthy kids meals, lower sodium meals, and smaller portions were somewhat to very important to have available. And 58% of the residents surveyed agreed that these items are now easy to find in the restaurants. This type of data helps you understand residents as well as helps you to work with your restaurant partners more effectively. Understanding the needs of your restaurant partners and residents helps you build successful and sustainable interventions. These interventions will differ based on the needs of your community and the goals of your partner. This is Ginny, and Ginny was one of our biggest skeptics at the beginning of the program. She liked the idea of being involved in the initiative. However, loudly and frequently, she voiced that it's not about health, it's about sales. If items don't sell, she couldn't continue to offer them. She was also very skeptical as to whether the restaurants wanted healthier foods on the menu, but she agreed to partner, and she found success. In the end, she turned out to be one of the project's biggest fans and advocates. We also know that success stories are impactful. It's important not only to tell success stories of your residents losing weight or controlling blood pressure, but also of your partners. This recognition keeps your partners engaged as well as gets other restaurants wanting to be involved in your initiatives. So in summary, did this all work? From our baseline assessment to our final restaurant food environment assessment in 2018, we did see improvements in the number of non-fried vegetables, smaller portions, and vegetables or salad being offered as defaults to fries on restaurant menus. Fruit was a hard, healthy practice to maintain on the menu due to the perishability. And the results also showed that there continues to be work to do to ensure that healthier foods and beverage selections are available. Of course, we don't want the progress to stop. The reality is that this work is time consuming and needs to be intentional, but partnering with restaurants, finding common ground, and working together can be successful to supporting your community health and well-being. We're going to, at this time, open it up to a few questions.
All righty. Thank you to those who added questions to our Q&A pod. Again, if you would like to add a question, feel free to add a question to the Q&A pod located at the bottom of your screen. The first question we have is, this work takes resources. Are there other ways to influence the food environment that doesn't take as much staff time?
I think that's a great question. I think there are different ways you can think about this. I have seen successful initiatives that people undertook short-term programs to get people thinking about healthier foods in restaurants. And it was also a nice defined time frame where restaurants could work with you to do this. So it's like restaurant week. A lot of communities have that where there's a week that they focus on specials. You can do that with restaurants around healthier food items too. I worked at a company where we worked with restaurants and had a month-long healthy food challenge and challenged restaurants to offer healthier foods on the menu, and really promoted during that short time frame people going out to try these menu items, and that was very successful.
So can you speak more about the Swap It to Drop It campaign? Specifically, is this a campaign that is available to other communities?
Yes, the Swap It to Drop It campaign was actually a social marketing campaign that was done throughout the community. So, as I mentioned, we focused on 100-calorie food swaps that people could make to manage their weight. We did work with restaurants with this campaign, but we also had the campaign running in grocery stores, convenience stores, at work sites. People could see the campaign information in the clinic as well. And then we did community wide promotion of the campaign. So, all these assets are available to other communities. So, if you're interested in learning more about this campaign, or if you were interested in implementing it into your community, please feel free to contact us. And I'm putting our contact information on the screen now.
All righty. Thank you once again for joining us. You can get more information about the Rural Health Transformation Center and access all of our tools and resources via the first URL link in the chat pod. If you're interested in our work and would like to receive more information, or if you have questions, feel free to email us at populationhealth@mhif.org. Thank you again for joining us, and have a great day.